A leading psychiatrist in Hong Kong has poured cold water on the government's plan to improve mental health services. This came as Undersecretary for Health Libby Lee said authorities are still finalizing the details before the scheme is launched in the near future. To improve people's mental well-being, the government is mulling a pilot scheme which will offer residents mental health assessments at district health centers. Those who require further consultations will be passed to community organizations for follow-up. Reports suggest the scheme could be launched as soon as next month, with clinical psychologists and social workers forming the backbone of the operation. Responding to the rumors on RTHK, Undersecretary for Health Libby Lee said that details have not been confirmed. But she expected newly discovered high-risk cases to be referred to psychiatrists, while minor cases will be directed to mental wellness centers overseen by the Social Welfare Department. The revamp came 1 week after a man with a history of mental illness randomly stabbed 2 women to death at a Diamond Hill shopping mall. But Lee insisted the double murder has nothing to do with manpower constraints in the mental health sector. With less than 400 psychiatrists serving a population of 7.4 million, the ratio is less than half of what the World Health Organization recommended. Lee said the international rule is not a one-size-fits-all policy. On the same radio program, Eric Chan, chair professor at Hong Kong University's Department of Psychiatry, admitted the lack of psychiatrists has led to substandard practices. This included assigning patients only several minutes per consultation. Chan slammed the 10 measures proposed by the government as weak, insisting the problems will not go away as long as there is a manpower crunch. Alan Din, a social work lecturer at Chinese University, was concerned about calls to tighten the criteria for discharging patients from psychiatric facilities. He warned this might discourage people from seeking treatment.